Good morning, everyone, and thank you for joining us. I hope each of you are keeping well and adjusting to the new normals of work and living. My name is Aaron, Marketing and Communications Manager at the British Malaysian Chamber of Commerce. Since the MCO began, and as part of the Chamber's plans for business continuity, we have been actively organizing numerous webinars from a wide range of topics with our members. Today, we will be addressing a very pertinent topic that affects us all, whether we are at work or at home: spinal care. We are thus delighted to collaborate with KPJ Healthcare on this topic: how to protect your spine and PL3D treatment. This webinar will aim to explore the importance of correct posture at work and ergonomics, the indications and techniques available prior to surgeries, and how to obtain adequate pain relief post-surgeries. Joining us today is Dato Dr. Abdul Wahab Abdul Ghani, Orthopaedic Surgeon and Medical Director at KPJ Ampang Puteri Specialist Hospital. We also have Trimeta Liastiza Puteri, Corporate Executive at KPJ Healthcare Berhad, who will be moderating today's session. Thank you both for joining us today. Before I pass over to our speaker, a friendly housekeeping reminder to be forthcoming with your questions during this session. However, making sure to drop your questions in the Q&A function available at the bottom of your screen and not in the public chat function. We will address your questions after the presentations are complete. So without further ado, I'd like to invite first Trimeta to begin the session. Over to you, please.
Yeah, thank you, Aaron. So hello, everyone. Thank you to attend our webinar today morning with BMCC and also KPJ Ampang Puteri Specialist Hospital. We have our special guest today, Dato Dr. Abdul Wahab. He's an expert in orthopedic surgeon, and yeah, he practices in KPJ Ampang Puteri Specialist Hospital. So basically, I just want to give a brief information about KPJ. So we are one of the biggest specialist hospitals in Malaysia. We have about 28 specialist hospitals in Malaysia, and also we have in Indonesia two hospitals in Indonesia, one in Australia, one in Thailand, one in Bangladesh, and yeah. Also, we are accredited with GCI standard, especially KPJ Ampang Puteri, and some other accreditations as well. Yeah, so welcome to our seminar, to our webinars about how to protect your spine and also PL3D treatment. This is very good one that you don't need to do any surgery, but only using these high technology lasers, and it will be good for your spine at the end. Yeah. Okay. I think just this from my side. I will pass this to Aaron, so we can start soon our webinar with our doctor. Okay.
Thank you, Meta.
Oh, sorry. Another thing, I will showing you also KPJ Ampang Puteri video. So we will have a look what exactly they have and the technology, yeah, everything. Then we can learn together also. We can see. Okay, I think we can start the video. Yeah, our hospital team, please. I think there is technical problems. Okay, I think it's complete.
All right.
Yeah.
Thank you, Meta, for the introduction to KPJ. Now, on to the main presentation. Our speaker today is the orthopedic surgeon and medical director at KPJ Ampang Puteri Specialist Hospital. A father of two, Dato Dr. Abdul Wahab Abdul Ghani, commenced his practice at KPJ Ampang Puteri Specialist effective June 1995. He obtained his MBBS Malaya in 1981, FRCS Glasgow in 1987, FRCS Edinburgh in 1987, and MCH Orthopaedic at the University of Liverpool in 1989. Now, with much anticipation, Dato Doctor, over to you, please.
Thank you. Thank you very much. And thank you for inviting me to talk on this webinar today on the topics of how to protect your spine and PL3D treatment. And thank you for the nice introduction, Mr. Chairman, I guess. Aaron, thank you. Okay, I hope I'm quite clear, and I hope everyone can hear me well. I think although the topic of today's webinar is how to protect your spine and PL3D treatment, I would approach the subject by talking a bit more on back pain, and then a bit more on treatment that is available, to treat back pain and neck pain. And then I'll be touching on PL3D treatment, And then at the end part of this of the talk, they'll be touching on prevention or how to protect your spine. So basically, first I'll be introducing the back pain issues, and then a bit history of lasers. There's some studies to show how laser works, and then the different type of these herniations, and then we'll show a bit of MRI pictures here and there, and then the techniques of how to do PL3D or how we do PL3Ds, and then some results, pre and post-op. And I'll be also putting in a small part of study that we have conducted in our centers to show that it works, this technique works. And then at the end of the talk, we'll be talking about ergonomics, okay, and how to protect your spine. Now, I think everyone knows that slip disc or herniation of intervertebral disc or prolapse intervertebral disc is a common cause of back pain and neck pain, okay? Especially in the current setting where people use a lot of computers at work, all right? And most of them are doing sedentary job like sitting down and work on the computers, especially during these MCOs or PKP, as how Malaysia put it, PKP or MCOs. Now, there's one issue. The other issue is when you look at history, basically we are poking the disc, okay? We are poking the disc with a needle. It's not something new. We've been doing this for some 30 odd years or more than that before. Even when I was doing my training in the UK some 30 odd years ago, we've been poking the spine with a needle. But of course, at that time, there were no lasers. So we were using some chemical substance called carmopepene. And the idea was to dissolve the disc and to reduce the pressure in the disc so that the pressure on the nerve is less and so that the pain reduced. But somehow at that time, when carmopepene was used, it caused a lot of discitis or inflammation. So we have to abandon the procedures. And carmopepene became so unpopular since then. And then there's a lot of other things that people do to reduce the disc pressure or intradiscal pressure. There is radiofrequency heating. They were using, some centers were using ozone, and then came a bit later after that, lasers. What we are doing now is special lasers that we use diode lasers. But before that, can we start the slides, please? Next. So I started doing this laser work in 2018, but before 2018, some 5 years before that, I was using radiofrequency ablation and also plasma lasers. Since 2018, I've changed my laser treatment using this device, which we call diode laser or PL3D. Now, if you look at the history, between 1984 to 1989, there were a series of studies being done, and all these points out that a small reduction in volume of the disc is the soft part of the disc, that is the nucleus, or we call it nucleopulposus in medical term. So when you reduce a small volume of this disc, you can actually it can result in considerable fall in the intradiscal pressure. So by doing that, you can reduce the pressure or the impingement of the nerve, all right, or spinal nerves. So thereby reducing pain or improving pain. Now, in the late 80s, Altman have shown that by applying lasers, you can reduce more than 50% of the intradiscal pressure. Now, the next slide. Actually, no, sorry, before this. Okay, this slide just to show you that how small the needle that we use for this procedure. We use a 21 gauge needle, and the size of the laser fiber, which is made up of silicon, is only 400 microns. So it's very small. And by putting these needles and the laser fiber into the soft part of the disc, there is the nucleus, we can reduce or cause this shrinkage, and we can cause vaporization of the disc, and the gas produced is evacuated through a device. Okay, I'll show that later. Next. Next. Okay, this slide just shows some studies that was done, by all the various authors, and I think you can just concentrate on the studies that produce more than 80% of pain relief, and I think all these studies have shown positive results. Okay, next. Now, what is important is that when you use something in the disc or somewhere around the nerve of the spine, we cannot use something that produces a lot of heat, because heat can damage the nerve, so we need to control the heat. So if you have a device that produces more than 50 degrees of heat, is quite detrimental or can be harmful to the nerve in the spine. So PL3D produces maximum of 50 degrees of heat. So that's quite safe for the nerve, okay? Next. Now, this is a study done in Spain. I think, next one. If you look at this video, then this is a study to show the temperatures that they can get by introducing laser in the disc. Video doesn't work. Okay, the different devices or needles and also the laser fiber that we use. And then this is the lesion that we produce. And the temperature is only about 50 degrees centigrade, which is very safe to apply in the nucleus. The next study, I think, is better. Next video, I think we just proceed to the next video. Next one. This study is an in vitro study to show how the nucleus can shrink after laser being applied. So there is nucleus pulposus, and they are applying the same laser to the nucleus, and they showed how small the nucleus can be, after applying the laser. You can look at the scales. Now from 20, it has become now almost 15, 14. So you can see the shrinkage of the disc. So that's pretty convincing, isn't it? You can see how small the disc can be after applying the laser. Of course, we don't apply that much energy. You just need a bit of shrinkage to reduce the pressure, maybe about 50%, okay, in the disc, so that there's less pressure on the nerve, thereby reducing pain tremendously. Okay, next slide. Next. Okay, these are the various different types of herniation that you can get. I think we divide in two big groups. One is contained disc, which is suitable for laser treatment. And the other one are all non-contained. Next. These are non-contained disc, and this sort of herniation or slip disc usually requires surgery. And if a patient wants to buy time and they're not keen or surgery yet at that time, we can offer other procedures to relieve pain, like a RAX procedure or epiduralolysis, okay, of the herniation. Next. Now, I'm going to show you some MRI. MRI stands for magnetic resonance imaging of the spine, and the type of disc prolapse or disc herniation that is suitable for the laser treatment. This is one. You can look at, there's no pointer. Okay. So you can look at, yeah, there's, can you see? Yeah. You may have. You bawa di sini kan, you bawa kat ROI ni. Okay, just concentrate on that red dot there. So that's where the disc is. So these are all small discs, but they can give rise to a lot of pain. Although, you know, on the MRI, they don't look that bad, but they can produce a lot of back pain. Okay, next. So this is a bit, you know, extending our indication. Of course, we can do this, but if you look carefully, this is quite a bad spine, and we may have to resort to other procedures as well to relieve pain, even without surgery. Next. This is a neck where you can see this prolapse somewhere there. So we can try using laser treatment for this sort of this prolapse. Next. Another one for cervical spine or the neck. Okay, there's the disc. That's where the disc is, you know, that bulging thing. Okay, next. Okay, the advantages of doing this procedure, I think we put quite clearly here that number one, the patient recovers from the intervention and can walk home in less than 12 hours. Number two, we feel the improvement of the symptoms right after the anesthesia effect are gone, with practically no post-op pain. Number three, the procedure is painless. Of course, we use a local anesthetic. It is minimally invasive, and it is an outpatient procedure. A patient doesn't need inpatient to be admitted as inpatient, and it can be performed with local anesthesia plus a bit of sedation. There is no periradicular scarring and less recovery and rehab time. This is just a picture of the annulus. If you were to do surgery, you can see that the annulus or the nucleus will look like this, you know, when you remove. All right, next. Now, this is a video of how we do a laser discectomy for the neck. I think yeah, I think it's a 3-minute video, isn't it? A 3-minute video, and we just use X-rays to locate the level and the position, and then we introduce the needle from the front of the disc. So that's where that's where the head is on the left side, the body is on the right side. It's not very clear, I think. It's not very clear. So once you are sure where the needle is and it is in the right place, then we will introduce the laser fiber. So this is still positioning. This is still positioning. Okay, we have to make sure that it is accurately inside the disc that we require to treat. So we look at the X-ray from the front and from the side so that we can be very certain the depth of the needle. And once everything is done, then we will put in the laser fiber and fire the nucleus with the diode laser up to 150 joules of power. Kita pendek lagi. Forward.
Ini patah balik lah.
Patah balik.
Tak mana?
Forward. Sampai. Lagi. Okay, the positioning ya tak ada. Okay, I think we can go to the next slide. Okay, this slide just to show you is a lumbar treatment. Laser treatment for the lumbar region or the lower back. And now, so that's the needle. There's the whole needle. And then the laser fiber, this laser fiber come into the needle. And then there's another connection here where we connect the suction pump, okay, suction tube, so that we suck all the fumes that's produced by the laser, thereby reducing the incidence of inflammation in the post-procedure period. Okay, next. Now, this is a bit technical, maybe for the doctors. I'm not sure whether there's doctors in the audience or in the participants. But what I'm trying to show is a bit difficult sometimes to do for the lowermost lumbar disc level. So that's why we introduce for the lumbar 5 sacrum 1 lesion. Okay, just at that corner there where my red marker is. All right. For the other level, it's quite easy, but for alpha L1, it could be a bit of difficulty there. Okay, next. This is the X-rays, and this is the model to show where the needle will go through. So it's somewhere there, in between this facet joint and the nerve. So we have to hit somewhere there. We don't want to hit the nerve there. And on the X-rays, because we don't see this, when we're doing in patients, so we see only this. So the image and the point of entry is somewhere here, right? Just very close to the facet joint. We have to avoid that line there, okay? We have to avoid that line there. There's the line of the nerve, okay? So that red mark is the right entry point. Next. Again, this is X-rays of, it is from the front, this from the side of patients undergoing this procedure, and to show the actual position of the needles. Next. Again, actual position of neck in the AP view or anterior view or from the front. And the next is a lateral view, okay? This is a lateral view or from the side. So we have to always have these two views to be certain that needle is correctly placed. Okay, next. Again, next. Now, this is just to show you the look of the disc, the herniated disc, before and after the procedures. So you can see that before it is quite big there, and after the procedures is gone. Okay, next. Okay, this is just a short study that we have analyzed for the year of 2018 when we started doing this procedure between March to September. Next. We have, at that time, we have about 59 patients, which we have included in the studies. And the procedure is done by me and my colleague, Dato, Dr. Alino. We have 59 patients, and next. And 30 patients were males and 29 females. Next. And we have 63% of them with moderate pain and 34% with severe pain. Next. And the number of levels that we applied the laser, or number of problem disc, number of level with problem disc, 68%, majority with single level, and 27% double level, 2 levels. Next. And these are the results of the pain score that the patient had post-operatively. 82%, and more than 80%, managed to achieve less than 3/10 post-procedure pain, okay? 13% with 4 to 6/10, and 5% is outright failures. So we do have failures, and these failures, normally they need other procedures, other pain interventional procedures, or some of them may need to go for surgery, all right? So at least we have more than 80% actually, giving you an excellent pain score after the procedures. Next. And we have not recorded any complications to date, okay? In when we first started in 2018, we haven't had any complication, and I've done probably about 500 cases by now, and thank God we haven't had any complication at all. And the conclusion is 59 patients underwent PL3D or the laser discectomy at our centers in 2018, and 90% of them have excellent outcome, okay? And 11 patients, 9.7%, had recurrence of low back pain with sciatica requiring other procedures. So we can conclude that this technique of PL3D is our latest interventional procedures we offered at the center, and there's no scar tissue formation observed, okay? Now we also do a lot for cervical cases now. Until this is in 2019, we have done about 25 patients, and at most time for cervical cases, we achieve very, very good results. Somehow, maybe because in the cervical spine, the stresses from the weight of the head is not as bad as in the compared to lumbar spine, where lumbar spine is holding the whole weight of the body. So we do observe much better result in the cervical spine compared to lumbar spine. Next. Just to show you a patient, this is my own patient before the procedure. You can see that there's the disc, and this from the top, this from the side. Next. So after the procedure, some 6 months, 6 months later, we found that the disc has shrunk, and this from the side and this from the top. Okay. Next. Now we haven't had the opportunity to do a repeat MRI for all patients because this is a private center and everything costs money. So I'm putting this other MRI from the experience of my friend in Spain. Next. So you can see that this is before this is before doing the procedure, and this is after doing the procedure. Okay. And again, you can see, oh, this is a bit blocked. So you can see this is almost not suitable for laser, but I think he tried, and yet he can achieve quite a good resolution or dissolution of the herniation. Next. Again, this is pretty obvious that this has come out almost out of the envelope, and that shown that the dish has shrunk very well. Again, another one, big disc, and that's gone as well. Big disc, and that has gone as well. This is from Dr. Pasquale in Spain. Okay, now let's touch a bit of the ergonomics at workplace. I think if you look at me, you can probably give a quick comment that I can't sit still, isn't it? I've been moving. If you look at me, I've been moving from the first time the first time I talk. I've been moving fairly a lot, and I think the idea is to never sit in one place. So that's why I put here, motion is medicine. Eh? So you must go for a walk. You need to work sitting down. You must go for a walk during your break or even lunch break, okay? Take the effort to go for a walk, okay? You can try to set alarm, you know, on your handphone or computers to remind you that you need to get up and move. And the best is every half hour, okay? That's the best. Issue number 2, I think these days they have developed a new workstation, sit and stand, where the table can be brought down for you to sit, and also you can, and after a while you can stand and do your work by bringing up the table again. And this will reduce pressure on your spine, enhance blood flow to your body. Next. So the other tips that you need to know is, of course, you need to set up your computer screen at your eye level. So the top part of the computer's screen must be at the eye level. The chair that you use must have good lumbar support. You should sit back into the chair. And if the chair don't have lumbar support, you can use a small pillow to help your lower back maintains its lordosis or the curve, okay? So your forearm, your thigh must be horizontal, and your hips and knees must be at the same level. And if you have to answer emails, a lot of emails, try not to use your cell phone or tablets, use your computers, okay? Now, so again, the posture and keyboard techniques, maintain straight shoulders, elbow at 90 degrees, okay? I think we can go back to the picture of the lady sitting just now. Computer glasses, I think for those who have got multifocal glasses to improve their eyesight, you may opt to get a computer glasses so that you don't have to tilt your head so much, causing fatigue in your neck when you were doing your work. I think can we go back to that picture that we had just now? Okay, if you look at this lady, you know, sit back, make sure your chair has got lumbar support there, all right? Shoulders straight, all right? And elbow, forearm quite horizontal to the floor, all right? So elbow usually at 90 degrees or more than 90 degrees, okay? And then hips and knees, same level. Good idea to have good footrest there, all right? And then the top part of the screen is at your eye level, all right? Okay, so try to do this to protect your neck and your back. All right, next. Next. All right, thank you so much. I think now we can come to question time.
Thank you, Doctor, for your presentation. We will now take some questions from our attendees, of which there are a few. Perhaps I can start with the first one, Meta, and you can take the next one. So Dato, what is the most common spine problem for women after childbirth? This is by Nicholas. Hello.
Okay.
Yep.
Just to answer the first question by Aaron, I think even after childbirth, or even before childbirth, the commonest cause of low back pain and neck pain is still slip disc. Of course, we have other possibilities of pain, but you see, most of the time we cannot see these causes of pain on MRI. the one that we can see are usually a bad disc or a bad facet joints or a bad big joints, in the front. So a big joint, you see, the way we look at spine simply is that they have big joints and small joints, okay? The big joints are in the front where you have the disc, and then you have the small joints at the back, which we call facet joints, okay? And bad joints we can see on X-rays and MRI. Bad discs you can see on X-rays and MRI. But we don't normally see bad nerves or bad ligaments, on X-ray or MRI. So sometimes we have to do a bit of exclusion technique where we treat first the positive result that we get on MRI, and if that fails, then we also try to treat other things that possibly may cause the pain.
Right.
But overall, I think you can still take that prolapse disc or slip disc are the commonest cause of bad back or pain in the back or pain in the neck, with or without pregnancy, or even after child or after delivery.
Thank you, Dato. Meta?
Yeah, we have also another question from Dato. So, seems to be very good result, Mr. Wahab. What are the common complications post-procedure with the PL3D compared to other methods of hysterectomy?
To date, we haven't had any complications, all right? But I think most important is to put the needle placement must be accurate. So maybe because in our centers, this procedure is performed by me and by my colleague, and both of us are about the same age, and then we are quite seniors in the treatment of spine. So maybe the placement of the needles is so accurate that thank God we do not have any injury to the nerve. I think we have to be careful with injury to the nerves, okay?
Yeah. Another question again from the same person, Eto. Yeah, he said, thanks to Dr. Wahab for the insightful sharing. Just wondering, is this treatment procedures is considered gold standard for PID or no?
For contained disc, I think for contained disc, please be careful that if you go to a surgeon, when you have contained disc, do not agree to surgery. Do not agree to surgery. May it be open or endoscopic, I think you must seek a second opinion. All right, that's most important, because contained disc, you can make it better by doing an intradiscal percutaneous. That means just poking the disc, and then apply. You can apply a lot of things now, but the best I think is PL3D at the moment. PL3D, a diode laser. You have other types of laser like plasma laser, but be careful, plasma laser produce a lot of heat, all right? And I have also used RF, radio frequency generator, but the amount of shrinkage or production of vacuum with RF is not as good as lasers. Okay. So that's why I'm now going for lasers. Yeah.
Yeah, agree.
Of course, for me, it's gold standard. Yeah.
Yeah, agree. I think Aaron, you can take the
Dato, still on PL3D then. One of the questions from Rahazwan is, how long is the recovery period?
Okay, we tell the patient to go a bit easy on the spine for about a month to 6 weeks, all right? But the feel-good effect is almost immediate. The feel-good effect is almost immediate. But we tell them to go slow or do not lift anything too heavy and allow the disc to heal. And the best time is probably around 6 weeks.
Okay, great. Thank you, Dato. There's another question here asked anonymously, and it's quite specific. If you are diabetic under control and you have experienced L4 and L5 slip disc, what are your recommendations?
Same thing. Diabetes is not a contraindication for this procedure. Make sure the diabetes is well controlled. Of course, before the procedure, we'll check the blood sugars. and the HbA1c to look at the control. If it is not well controlled, we will control the diabetes first before we embark on the procedure.
Right. Okay, I hope that answers the question. Metza, do you have another one?
Yeah, we have also from Adrian Abu. So the question: ballpark cost of the procedures for minimal spine spondylosis or disc bulge at C6 or C7? Is that at C6 or C7?
Okay, at the moment,
Yeah.
when we sell this product at our, when we go for a medical tourism trip to Indonesia, I think we try to reduce the cost to 21,000 ringgit. 21,000 ringgit, and we said we don't care how many levels, we just do it at that, one ballpark figure or one ballpark price of 21,000 Malaysian ringgit, which is very, very cheap, I think.
Okay.
Maybe I'll ask the next one. This one is from Muhammad Sharizan, and he's asking about any recommendations for specific exercises that we can do to protect our spine. In that line, I might want to throw in an own question of mine is that, sometimes when we crack, we move and then we do the pops in between our cartilages. There's been mixed comments about whether it's safe to do it. What are your thoughts, doctor?
Okay, I do that as well. I think when you crack maybe part of your body and you are actually doing stretching to your body, and if it doesn't cause pain, I think it's quite safe. So if you've been doing it, I think there's no problem because you're used to it, But for those who have got slip disc, you already got slip disc, it's proven with MRI, you have to be careful when you stretch. I think the technique must be proper, and I normally refer you to our rehab therapist, and they will teach you what exercises to do and how to stretch, okay? So once you have a slip disc, you have to be careful. But if you don't have a slip disc, then and your manipulations or the way you move does not cause any pain, then you're quite safe. All right. You can be an acrobatic as well if you're used to it. Okay. But you're not used to it. Don't overdo things.
Right. For the layman then who is at work typing away, any exercises that you can recommend?
Yeah. You just move and stretch. You move your joints, especially your shoulders, your hips, your knees, okay? And then for your back, there are exercises that you can do, but in the office, I think it's a bit difficult to do because you have to lie down and do it. So maybe you just stretch your body, your legs, take deep breathing, try to open up your chest and that sort of thing, You can maybe do a bit of bending, and expanding your spine, moderately. But I think the problem with office, sometimes you need some space to do it. So you just do whatever you can in the office. But back home, you probably can do a bit more. And for those who have got access to swimming pool, I think swimming is the best exercise for your back. Just go for swimming. Take up swimming as a hobby. If you don't have a pool, build a pool. Government to build one.
Yeah, I agree that one. Yeah, swimming is the best. I also having the same problem on my back, and then I went to the orthopedist, and they asked me, "Okay, you just go swimming, Meta."
And the problem with Malaysia, we are building too many golf courses, but not many swimming pools. I think we have to push the government to build more swimming pools and less golf courses.
Good idea.
I'm not a golfer.
Good, doctor. Okay, we have also a next question from Ho. Yeah, they're asking where can we get ergonomic chairs? Do we have in KPJ Ampang, Puteri, or do you have any recommendations?
We don't, but you can Google and look at there's a lot of advertisement on the net. I think it's not difficult to find one.
Okay. And the next one, do you recommend, from Asmin Othman, do you recommend the treatment to 80 years old person?
Okay, if the disc is already dry, If the disc is already dry and hard, there's no point doing the laser. But we have other techniques to reduce pain. We have other techniques to reduce pain like epiduralysis or Rex procedure, and we have radiofrequency pulsing or radiofrequency ablation. All right. So we have other techniques to reduce pain, not only laser. Because in 80 years old, usually the discs are quite dry and hard. So we cannot really vaporize it anymore.
Okay. So it depends, yeah, case by case.
Yeah.
The last question we have from Rofiza Razali. There have been ongoing trend that people are seeking alternative treatments such as chiropractic and osteopathic medicine. What's your take on this? What's your recommendation or anything?
Again, I don't know the art of chiro and art of osteopath. I haven't gone for a course on that, and those belief or techniques are not being told or not being taught in medical schools or even in our postgraduate training. Okay, so it's a bit difficult to comment on what people do when we don't know what they are doing. All right, but I think the modern medicine or the surgery that we do and the procedures that we embark in a hospital usually are evidence-based. We cannot practice something without evidence. We must have evidence. So as long as you're careful, if somebody tries to manipulate your spine and it causes pain, I think you have to be careful, all right? Because they can make things worse, that's all. Okay. I cannot comment too much on that.
Yeah, understand. Yeah. I think, Aaron, you can take the next question.
Yes, this one here from Miss Caroline Craigs. Why are some people more predisposed to prolapse disc, and what are your recommendations for them?
Again, there are people who came to us or to the doctors, to the orthopedic surgeon with multiple disc prolapse. And we believe that people who have got multiple disc prolapse, they are actually born with weak disc. That means the annulus or the containment or the envelope of the disc is a bit weak, so they can easily give way and breaks. So this happens at multiple levels of their spine in the lumbar or cervical area or the neck area. And they are a bit unfortunate because they are born with weak disc. But most of the time, people has developed only one or two disc prolapse from injury, from a wrong way of lifting or from accidents or from, bending injuries and from lifting to heavy weights, So most of the times it's injury related, but sometimes like what the Caroline was asking is that people probably are born with weak disc. So that's a bit unfortunate, and that's probably difficult to find out why and how.
Yeah. So an element of genetics and
yeah,
inherits as well.
Yes. Nobody has isolated the gene anyway.
Yeah. Meta, you want to take another one here? Meta, you're on mute.
Okay, sorry. Yeah, so we have another question here. The last one, I've been having lower back pain for several years, mainly focusing on the left lumbar region or the SI joint. The pain sometimes travel down to leg, and it's tingling or numbness. The pain certainly increase with the exercise like badminton or any other exercise, maybe sitting or standing too long. I've had chiro or acupuncture session, and it helps, but often relapse within a short period of time. So what are the step-by-step to rectify this? Yeah, maybe what the treatment you can mention.
We have to examine the patient, and particularly this patient, we have to investigate, and MRI is part of the investigation. And by then we almost can establish the cause of pain. And once we have established the cause of pain, we usually start off with a course of physiotherapy. We send them off to physiotherapy, who will work with patients and get rid of the pain in their back or try to improve the pain in their back by doing there's so many, ways of reducing pain by physiotherapists. They can use shortwave, they can use lasers as well from outside. They can use ultrasound to ease pain, and then they'll teach the patient some exercises to do to improve their pain. And again, if they know how to swim, I think they should start swimming, to strengthen their back. And once physiotherapy fails, I normally use about 10 sessions of physiotherapy, and after 10 sessions, I will reevaluate the patient and find out whether they have improved or not. If they haven't, then I try to tell the patient that we have other procedures that we can do to alleviate pain. Okay? And laser will be some of it, depending on the cost. PL3D can be, a treatment.
It sounds like PL3D is able to address a number of issues, and I think today's session has given us a greater understanding of this particular method. I think that's all the time we have today, Dato. Thank you very much for your time and for the explanation. And to everyone who joined us and for sending your questions as well. I think the key takeaways, apart from all the technical explanations, to do stretches if you have a sedentary working lifestyle, and move around, and to take up swimming too, if there's a pool nearby, or to get your community to build one. So once again, thank you, Dr. Abdul Wahab and Meta, for your time and insights. And of course to KPJ Healthcare for making all this possible. We hope to see everyone for our next webinar. That will be on the 2nd of July, and the topic will be the changing face of higher education post-COVID-19. For more info and registrations, you can head over to our BMCC website. Once again, to our speakers and KPJ Healthcare, and to all of you who attended, thank you very much, and take care.
I think I will say some closing also. Yeah.
Yes, please, Meta.
Yeah. Thank you, Dato, Dr. Wahab, for the excellent idea. And for the talk is perfect. So now we know this PL3D is the answer for all the common case for our spine. And yeah, we would like to say gratitude to BMCC to host us, especially to KPJ and Puteri also. Yeah.
Thank you.
Thank
you, Meta, Miss Meta. Thank you. Thank you, BMCC. Thank you, Aaron, Miss Karen and team, and KPJ Healthcare for organizing this webinar. Hopefully it's very fruitful for everybody. Last but not least, during this COVID-19 pandemic, we are KPJ Ampang Puteri open as usual.
Yeah.
Thank you.
Thank you.
Also, thank you for all the participants for your time. And if you have other questions or anything related to your back pain or even any other things, you can come immediately to our hospital. We open as normal, 24 hours. And you can meet also our doctor immediately, Dr. Abdul Wahab, to his clinic for your further treatment, or even if you have any other questions. Okay, we welcome you anytime. Thank you so much, and thank you, Aaron.
Thank you. Thank you. Bye.
Bye-bye.
Okay, thank you. Bye-bye.